Welcome, everybody. Good evening and good morning. Good evening and good morning, everyone, and welcome to the Gyaan Vardhini session number 23. I am Anand from Cleansav team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. So, before we begin this webinar, I would like to share a brief overview of our amazing Cleansav app that we have developed over the last 6+ years. Cleansav means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full 100% offline mode. It has a very simple design. Cleansav helps doctors easily manage patients' appointments, case papers, full prescriptions, bills, fees, issue of pre-filled letters, manage finances, and doing follow-ups with patients for any outstanding dues. Cleanser also sends automated appointment reminders 1 day in advance to your patients through SMS, and it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. Now we shall be starting our today's webinar. Our today's webinar topic is From Doctors to Vaidyas, Surfacing Compassion-Based Ayurveda. Our distinguished speaker for today is Dr. Namyata Pathak. Dr. Namyata Pathak has over 16+ years of experience, playing diverse roles in research, teaching, being an editor, director in healthcare programs, being a board member, and director and founder. Dr. Namyata is the founder of Ayurved, a US-based center for person-centered healing, clinical education, and integrative research rooted in Ayurveda. Through Ayurved, she is pioneering models of care that empower individuals with self-agency in their healing process and build ecosystems of collaboration among Ayurvedic and modern medical professionals. She also serves as program faculty at the UCSF, that's University of California, San Francisco, Osher Center for Integrative Health, where she teaches physicians in integrative Ayurvedic medicine and contributes to bringing Ayurveda into mainstream medical education. Dr. Namyata has been leading international efforts to establish academic standards for Ayurveda education and is a strong advocate for collaborative ecosystems that unite healers, physicians, and scientists in the pursuit of whole person well being. Dr. Namyata, we are honored to have you with us today to conduct this webinar. Let us all welcome Dr. Namyata Pathak for today's session. Dear ma'am, you can start with your session now.
Namaste. Thank you, Anand, for having me on your platform, and thank you for doing the great work to support the Vaidyas. Vaidyas need heroes like you, who really believe in them and are there to do whatever is needed. So, thank you for being that person for everyone in India. And it's been amazing to watch your journey in Ayurveda as well. You are the quite so today I wanted to share um, some of the ideas that have emerged through my journey, working in different platforms, looking at different ecosystems, uh, being being a clinician in India, being an Ayurveda educator in the United States, and running a personal practice while helping uh, to reimagine Ayurvedic wisdom being delivered in uh, licensed ecosystems and in unlicensed ecosystems. And how do we really bring forth this wisdom to allow Ayurveda to be percolated in the modern world that we exist? So, there have been a very diverse range of concepts and constructs that I have dealt with and learned from. And I hope to share some of the snapshots of my learning with you over the course of this hour and hear back also from you through a dialogue as to how do we percolate the wisdom of Ayurveda further. So, without much ado, Anand, could you please pull up the slides that are made? Okay. So, I chose to call this talk From Doctors to Vaidyas, Resurfacing Compassion Based Ayurveda, because there has been a thought in the United States, to create Ayurvedic doctors from ground up. And it's a very it's a much needed uh, it's a much needed next step that Ayurveda in the United States needs to take. And that has really allowed us to reflect on licensure, regulation, accreditation, clinical competence, why we do it, how we do it, and how do we do it in a land where culturally Ayurveda does not exist. And yet, at the same time, over the last 20 years, 20, 30 years, there have been great Vaidyas who have shared their wisdom, and a lot of seekers have come to learn this for their own healing and for the healing of their families. And this part is a gift, I feel, of the United States to the world of Ayurveda back again, because they're adults who are coming to learn Ayurveda for their own healing in a very in a structured manner. And I feel that that is something worth sharing uh, with the rest of the world. Having said that, how do we reimagine Ayurveda for clinical care and cultural percolation? These ideas remain open for discussion, and I wanted to bring forth those in the discussion. Uh, the focus on compassion based Ayurveda is very crucial, because as we build new structures with gigantic ecosystems that require manpower and resources to build, run, maintain, evolve, the seed that we are trying to magnify is very is worth thinking about. And what is the seed for health and healing? And how do we first find that? So it requires us to zoom in before we zoom out. And that's where finding compassion, finding the language that exists only in Ayurveda for systemic construction, we want to be able to bring that forth. Next slide, please. These are all my mentors, Dr. Rama Vaidya, Vaidya Ami Parikh, and Dr. Ashok Vaidya. My deep pranam to them, because what I'm sharing today really comes from the flows that they have opened up, the flows of Ayurveda that they have opened up for me. Uh, and I'm just a mere facilitator of the conversations that have come to me. Next page. Next slide, please. So this is a mouthy slide, so pardon me for that. But I wanted to put a context of the gross problems. I want to go from the gross to the subtle, and then we go to re-expansion of new structures. So the gross problem in India, the public health, we are now facing a triple burden of disease. It used to be a double whammy, uh, a decade ago, but now it's a triple burden of disease. There is persistent communicable disease. There are rising non-communicable diseases. Injury and trauma are are big, and diabetes is not slowing down at despite all efforts. Public health spending remains poor as compared to the rest of the world. It's at less than 2% of the GDP. And it was always a big concern that public health spending, uh, reduced public health spending, uh, is resultant in the negative numbers that we are seeing, the health burden that we are seeing, because we are not able to have public support, uh, governmental support for health. So, with all of these concerns, we also look at the context in the United States. So, next slide, please. In the United States, despite public health spending, the situation remains pretty similar, because US health spending is the world's highest. Nearly 19% of the GDP, and then it's going to be 19% of the GDP in the next few years. It is already 17.6% of the GDP. And yet the load of chronic diseases, uh, the health expenditure on chronic diseases is um, a big concern. Nearly $300 billion a year are lost in productivity costs tied to stress, absenteeism, reduced performance, and all of that. So there's not just the cost of ill health, but also the economic burden of not performance. And when you put it all in, it really seems to be like a ecosystem that spends so much more but is not able to build well-being from ground up. So, next slide, please. And the concern is real, because we are talking about 3.7 trillion dollars lost with productivity. Nearly 20% of the US GDP uh, is the loss, is the associated cost of loss, right? And by 2030, Americans with three or more chronic diseases will nevertheless increase by 267%, because the format for prevention and healing currently does not exist. The language for it does not exist. Next page, please. So there was this experiment that was done in the VA, which is the Veterans Administration in the United States. It deals with the U.S. war veterans, and they have a massive budget to rebuild health. So they have excellent research, academic infrastructure, excellent clinical care, and they thought, what would it mean to build well-being? And the idea of well-being then expanded to whole person care, and the tools and language for it were developed in conjunction with the WHO. And they implemented this healthcare model where the whole person came first, and the supportive mechanisms that are needed for the individual to heal themselves were all put together in a nice care coordinated teams. And they found that there was a 73% reduction in outpatient costs related to chronic illnesses, right? And when they did the analysis, there's this paper that's available in Financing Whole Health. When they did the analysis, they found that where a capitated whole health model could both mitigate the prevalence of chronic conditions and maintain corporate profits, the fee for service healthcare is not only unable to check the rise of these diseases, but is losing money in the process. So, the fee for service model that is used by most of the licensed infrastructure uh, is not necessarily the way forward. They need to refocus and refocus on whole health to actually reduce the costs. So next page, please. So Einstein said that you cannot solve a problem from the same consciousness that created it, and you must learn to see the world anew. So this is a classic model, classic example of that. That when they try to really solve the problem, which was a manifestation of a disease, the fee for service model did not work as well as when they shifted the focus to a whole person, right? Now, at the same time, when we take this idea a little bit further and we say that the the focus on using financial metrics as a way for problem solving, if we change that metrics and that language to the language of Ayurveda, what will that look like? So can we have the next slide, please? So we want to really go from reactive sick care to proactive whole person care. This is the mandate that is emerging the world over. So we are going from Vikara Shaman, from treating, to healing and Swasthya Rakshana. And that's the language that we want to bring forth for this new problem statement for which Ayurveda is so well equipped. So we are really standing at a cusp in time, and a time when the world is ready, more readier, well, readier for Ayurveda than what it was ever before. Next slide, please. So, I teach at the Osher Center for Integrative Health. They have just designed a fellowship program for clinicians to be trained in Ayurveda. And they go through an entire year of the course where they learn all the principles for health and healing, and they learn the language, they get introduced to the language of Ayurveda. It's a very nice curriculum design, and that 1 year format of introducing Ayurveda to adults from diverse fields is an excellent contribution from the United States. It's worth looking into. So, in that format, when Ayurveda is introduced, now I'll take a step back. OSHA centers, they exist when they exist in the university ecosystem, so they're there in academic medicine, and there are, I think, about 20 OSHA centers in the US today. Just 10 years ago there were only 3, but now they are all expanding because integrative medicine is becoming front and center. So they are developing the human the human potential for to serve in these settings. And OSHA centers, they also work very closely with the VA, the Veterans Administration, and both of these large models used to work very well with the WHO until recently, when there are some challenges with the new administration. But however, the language is developed in these big machineries. Okay, and over there we have whole person care. Uh, Becoming front and center, which is a fundamental of Ayurvedic medicine. And in Ayurveda, we train the Vaidyas to say Purusham Purusham Vikshya. So every individual is different. And how do we treat every individual different? In that, the focus comes on the Dashavida Pariksha, where you have Prakriti, Vikriti, Sattva, Satmya, and the whole nine, the all of the 10 constructs that we are using in Dashavid Pariksha, they need to be taught and they need to be shared. And through that, we learn how to treat the person who has the disease versus the disease itself. And that's a very subtle shift that we make and that we help the clinicians also make. So there were two, while I was helping to make this shift, I'd used two cases of autoimmune diseases, um, of two individuals with two middle aged men with autoimmune diseases, but my analysis of them was completely different, right? With the Dashavid Pariksha was entirely different. So we go forth to teaching that, sharing that with the clinicians here in the program, and they're really able to grasp it. They get the idea, and they feel very confident that there is something that they are able to do differently for different individuals. So it's very empowering to clinicians who had originally become clinicians to heal. So when they have this language and they have the idea of Ayurveda, they are able to uh, think more holistically and give specific suggestions to the person in front of them. So at the clinical encounter, we have the ability to transform it. We have the ability to make this subtle shift, and this physician who is within a licensed ecosystem can activate systems to drive the outcomes, build systemic efficiencies through collaborative processes, and develop that mode. So in some ways, we are helping doctors to turn into Vaidyas, right? Next slide, please. Now, when we really look at what India has for this, this amazing idea of percolating Ayurveda in different structured, existing structured ecosystems, we have BMSs who are India trained human capital for whole health, right? The potential exists because the language of Sanskrit, the language of the interconnections, the concepts, the theoretical understanding exists very well with almost all of the BMSs. We have the educational reach. We have 513 BMS colleges, 31,000 seats currently. And the practitioner base in India is nearly 400, more than 400,000 Ayurveda practitioners. Now, if we start speaking the language of whole health, bring forth the align with the idea of WHO and the well-being societies. And now that the WHO Center for Traditional Medicine exists in Jamnagar, if we are able to set up those collaborations, we will really be able to take the idea of whole health the next steps further. Because currently, the idea of whole health is not getting that much nourishment in the United States under the Trump administration. So, but it exists, all of the work, all of the science, and all of the research that was just very recently done now exists for the BMSs to be used, to be deployed in India. So, next slide, please. So I want to take a step back to say who are the people in India who would be able to really bring forth this shift. And this really requires us to take a pause and see what do we have and what do we need. And I wanted to go down to the definition of doctors and Ayurveda doctors, um, and see what does a doctor do and what does an Ayurveda doctor in India do. So doctors, they diagnose and treat diseases. They address known causes of diseases from based on retrospective and prospective research studies. Their advice is based on the guidelines of consensus, which are emergent, which change, and uh, they are generated from an evidence hierarchy that's based on certain Gaussian models, and they practice within the licensed frameworks often backed by insurance, right? Ayurvedic doctors in India, they are trained in accredited programs. Me. Okay. So coming back to this idea from doctors and Ayurvedic doctors and what do they do and what are our current strengths? We discussed doctors west in the conventional setting. In an Ayurvedic setting in India, in general, uh, the BMS doctors, they are trained in accredited programs. They are aware of diagnosis and treatment of most diseases from a Western and Indian perspective. They have access to the diagnosis and treatment of both. They also understand etiopathogenesis based on the dosha dhatu agni based assessment of the individual. They learn that pretty well. They also understand diet lifestyle corrections that need to be done for the doshas. and for also to some extent for the Agni. Yeah. Going back to the thought of what BMSs in India do and can do, they are trained to understand dosha dhatu Agni based assessment. They understand diet lifestyle corrections. They practice either in private settings, in Ayurveda centers, or in hospitals. Reimbursement for their services generally out of pocket, and I'm hearing that there is some amount of Ayush support that has started percolating as well. And some models have found ways to get into the insurance support. Now, are Ayurvedic doctors who are BMSs Vaidyas? And this is something that we can open up to conversation, because what we want to do is that we really want to support the BMS doctors to become to be in the front lines as the harbingers of health and well-being. And I wonder if we have utilized the whole potential of Ayurveda to really do the sanskara on these individuals who come to train as BMSs. Is there anything further that we can do to help and support them so that their experience of life becomes something that they feel like sharing in the clinical encounters? And this part of the journey is is I feel the missing link, because in the experiment that we did with the clinicians, and when we are talking to them in at OSHA Center and a lot of others who I have met over the years, it is the pathways of coming back to their own swasthya and what they discover in their healing journey. That is what really helps them to rebuild, uh, to rebuild their health and be the people who share what swasthya really looks like, right? So with that, I have some thoughts on what are the qualities of a Vaidya that we really want to bring forth. So next slide, please. Who is a Vaidya? The word Vaidya comes from the root vid, one who knows, one who understands the terrain of healing and pathways of well-being. I find that it is very difficult to imagine them on someone else. It really becomes easier when you have worked on them for your own self. And therefore, one of the missing pieces of the puzzle in the BMS curriculum is a self healing assignment. Okay. Who else is a Vaidya? One whose inputs lead to Shuddha Chikitsa. Shuddha Chikitsa is one where a disease is taken care of, but no new disease is created. Are we training? Are we equipped with what Shuddha Chikitsa really looks like? We need people who are skilled at the expansive possibilities of Nidan Parivarjan for Chikitsa. How do people change behaviors uh, that trigger ill health? And how do they build behaviors that build health? What are the emotional causes of diseases? What are the spiritual causes of diseases? All of these can't really be captured in the current models for disease assessment. Uh, Although that's changing, but in the mainstream, these aspects are not talked about in the clinical encounter. But as a Vaidya, we are able to bring them forth. Uh, a Vaidya is also someone who helps build swasthya without reliance on expensive products and therapies. One who is skilled in Sattva Vijaya and Daiva Vyapashya Chikitsa as much as Yukti Vyapashya Chikitsa. One who understands the chikitsa chatushpad exists. The treatment does not, the outcome of the treatment does not rely on the drug alone or on the vaidya or on the doctor alone, but also on the rugna, and there is a role of the caregiver. So the rogi and the caregiver, these are the two pillars of chikitsa chatushpad that need more strengthening. And who will be able to do that? A vaidya will be able to, a vaidya will be able to do that, because they are the one who can then share the power and agency with the rogi to build swasthya. We don't need systems to build health. We need people to build health. And we need systems to support the process of it. So we have the role of a Vaidya that emerges as a facilitator, an educator, and a guide. And once this interaction occurs, the patient works out. He feels lighter. He feels empowered to know that swasthya and healing are both accessible, and he can be his own Vaidya. So, next slide, please. So, this is for the state for the graphic. I really feel that, the wobbly world of healthcare that we have designed, we have forgotten chikitsa chatushpad, and the fact that all four legs are equally important. We have built a structure where the vaidya, the doctor, or whoever sits at this at the at the seat, he is the giver, and the rogi has to be the receiver. However, this dynamic needs a shifting, and that is something that can happen through a subtle shift which is strengthened with time. Next page, next slide. So we have vaidyas can be of multiple types. So you have a bms who can who can assume the role of a vaidya, a bishak, a chikitsak, because he understands the clinical context of what is happening in someone else's body, right? And a clinical Vaidya can then help to build many more rogis who are on their self healing journey through education. So he can create the Atma Vaidyas, the self healers. And those Atma Vaidyas, once they find it, they'll be able to share it with their family. They become Kutumba Vaidyas. And those Kutumba Vaidyas can then build structures, energetic structures, which build a samajik Vaidya or a community Vaidya. So that's how subtly the ecosystems can shift without an over reliance on preordained structures or corporate structures that uh, uh, that whose function is solely to drive the outcomes, but they are not by themselves equipped to drive it alone without taking the rogi along, without taking a vaidya along. And this is how we bring back the humanity in the conversation. Next slide, please. The humanity in in the conversation comes also because there's a fundamental mandate that Ayurveda gives to its healers, which is transcendence of suffering. That alleviation of suffering. It is not just the treatment of disease, it's also alleviation of suffering. And how do we do that? What are the methods for it? The mandate is there, the methods are there. So Charak says, Yoge cha mokshe cha sarva vedananam sarvasam vedananam avartanam. And through, so it's a way of transcending suffering through yoga and moksha. So that's how Ayurveda links yoga, brings back yoga into the conversation, and that is something that we need to focus on in India as well. Next slide, please. When we bring back yoga into the conversation, we realize through the inner pathways that we have agency on our choices. And I have realized one thing, that Ayurveda is inherently behavioral medicine, because the behaviors that we choose will build health. And what do we choose matters. And how do we choose? The guidance for that comes in the pathways of yoga. It is not for nothing that Achar Rasayana is considered as Uttama Rasayana. And when I used to read it as a child, as a younger adult, uh, it felt like a utopian world, of living in compassion, connection, having all of these, qualities. It just felt like it seemed like a heavenly community, if people would live that way. And Charaka says that if Achar Rasayana is followed, no other material Rasayana is needed. There's a statement that indicates that. Now, to bring forth Achar Rasayana, how can someone really bring that forth? Is through the practices of Sthita Prajna and opening up the pathways of yoga. Next slide, please. Next slide. Okay, sorry. And when we go down to the pathways of yoga, we realize that we can use anything as medicine. Sometimes rest is medicine, exercise is medicine, sometimes speaking is medicine, sometimes not speaking is medicine, sometimes, eating is medicine, sometimes not eating is medicine. And we as Vaidyas know that. What is the context of that? That is something that we need to be able to implement, share, and talk about. So the sutra in Charak is that there is no substance in the world that cannot be used as medicine. Nahi aushadam anaushadam nasti. And when you think about aushad, aushad is a dravya, and it is also an abhava dravya can also be used as a dravya. And when we look at dravya, what are the dravyas? They're the panchamahabhutas, and you have time, space, atma, and man. All of these four can be deployed in a clinical encounter. Next slide, please. When we use these techniques, when we use all of these on ourselves, we are able to enhance our own health as and the experience of that, the measures of that can be palpated. I've been sharing this little tool for about 2 years, something that measures swasthya. How well are you? It has 5 questions. It is so simple. And to me, these 5 questions relate to the panchakoshas that exist in yoga. And it is so beautiful to see where you are and how much love you need to give your own self, how much more compassion you need to give to your own self to become better. What can you do wherever you are without any requirement of any materials? How are you able to build your own health and well being? Find those pathways, because those are the ones that we as Vaidyas need in our lives, and to become the beacons that to become the beacons of a better world. Next slide, please. So when we find swasthya, we find that the qualities of divinity and the qualities that Achar Rasayana suggests us to, the behaviors that Achar Rasayana nudges us towards, they burst forth, they come forth, where we become loving of the truth, we become Shanti Priya, we act from Prajna, Karuna becomes the center. Now, this Karuna cannot be given anywhere outside when we have not learned to give it to our own selves. So, how do we learn self compassion? And through self compassion and self agency, how we stabilize our inner worlds. That is a beautiful pathway that we can open up for the BMS community. And through that, we can have the uh, we can have a whole new language of conversation that we are now working towards building. Next slide, please. So, through this pathway, when we find self compassion, we are able to see what are the ways in which we hurt our own selves and what are the abusive, self abusive choices when we say, I should do, I have to do, I must do, oh no, I have not done this. This is the negative self talk. I'm not enough. This is not, you know, all of this self talk we are able to observe and we're able to transcend it. We have more empathy for our own selves. And then when we are able to do that, we are able to see that and give that and share that more readily because we become a part of a flowing fountain. There's a slide that I had, but there's a poem that I had written when I was designing the course for the UCSF fellows. I was teaching them Nidan. And this poem might be published soon in the Journal of Ayurveda and Integrative Medicine, but there's a snapshot from it. It says, meeting the Vaidya reminds them of their light. Stepping into that oasis is their right. The right of that light is ready to be claimed, and the light of that right is ready to be shared. The light of that right is ready to be shared, that you have the right to, to, to be well. You don't have to flog, and you don't have to perform, and you don't have to do all of these things to prove your worth and keep proving your worth. What have you done for me lately? You don't need that, because once you find this inner center within yourself, naturally your roles burst forth, naturally you drive outcomes, naturally things come through you. So the light of that right is ready to be shared. We need to change the language with which we speak with ourselves and with each other to create a more harmonious world. And who is going to do it? Vaidyas can do it. Next slide, please. So Swami Vivekananda said that each soul is potentially divine. And I feel, can the BMS Vaidyas find that seed within them and become builders of a new humanity? Next slide, please. That's my guru, Vaidya Makrandave, and he wrote beautiful poetry, and he is a forever believer in the human potential, and and an amazing guide to transcend suffering and behold the beauty of the world that we exist in. With that, thank you for a patient listening. I'm open to conversations and thoughts. I'd love if everyone can come turn their videos on. Please feel free to do that.
Nami, that was a wonderful presentation.
Can't hear you, Himo.
Can you hear me?
Dr. Himo.
Yeah, it was a wonderful
I can't
presentation.
hear you.
You can't hear me? Okay.
Thank you, Dr. Himo.
Okay. So, Aparna, Dr. Aparna Subbu says that coming to the US about 35 years ago and not having a course like MAMS itself made me feel insufficient. Could you say something about that, Nami?
Uh, yeah, well, uh, I didn't quite understand uh, what you are referring to, did you feel like BMS was not sufficient, or was that a typo, or did you feel that you did not find a course like BMS in the United States?
I have invited Dr. Aparna Subbu on stage. Uh, if you just accept that invite, you can directly speak, Dr. Aparna Subbu.
I have to accept the invite.
No,
Okay.
no, Dr. Aparna Subbu.
Oh, okay. Yeah, we can't see all the participants, no, in the list.
Yeah, you can see. So
Okay.
there's Dr. Lata K, then there's Dr. Preeti Gupta, Dr. Surendra, Dr. Ashish Farke, Dr. Manisha Yarzal, Dr. Vaidya Scientist, Dr. Namyata Pathak,
Okay. Dr. Fadke, I would love your inputs as well on the yoga dimension and the thoughts. These were just, things that are stirring within from from the US perspective. But what are your current observations in India? And I would love to hear from you, Dr. Fadke. Is is Arunji also there?
Arunji.
Arun, Arunji and Dr. Fadke, they both have the yoga Ayurveda. They are both strong people, strong experts on yoga Ayurveda connection.
Yeah,
Sir
Dr.
says in the chat that he just wanted to mention
Ashish, sir.
salutogenesis.
Who wanted to mention salutogenesis?
Dr. Ashish Farke.
Oh, absolutely. Yes. The pathways for Ayurvedic salutogenesis, right? It needs documentation. I don't know how do we do that, but it's beautiful that these concepts are coming forth, even in mainstream medicine. So the language for it and the need for it is all ready. Aparna ji came. But
Okay.
Himu, what are your thoughts meanwhile on the doctor to Vaidya? What do you feel about it?
Just a minute. Dr. Ashish Farke is calling me. Somebody needs to answer. Okay. So, what I feel is a Vaidya can become a Vaidya only when he heals or he or she heals herself from within. And only if you are full with that healing can you heal others. Unless and until we do that healing and uh, we do not. Make ourselves full, then what we give to others, when we present ourselves to others as a Vaidya, we are we won't be able to give what we can actually give to the whole full potential.
Right. And also recognition of the parts of us that are not healed, right? Even if we have not completely healed, but recognition that this is this is something that is emerged, because there's also humanity in our life experience, but the awareness, I think, will help. How do you think that it should be a part of the training of the BMS structure, and how can that get into it?
I think this portion probably of making a doctor to a Vaidya, we have lot of doctors in our groups have been very lucky that we have been mentored by Dr. Devchand Gala, who actually trained us into the whole thing from becoming from a doctor to a Vaidya. But if I look at the interns and observers who come to us, I really feel that nobody teaches this part in the college, and it has to be something which has to be ingrained into the training. That how do you become a Vaidya? You're not just a doctor, you're not just a person who's going to find illness or just diagnose a disease. You're going to heal the person whom you're going to meet once you step out of that learning institute. So if we are not trained for this, I think we would be lacking something. It's a big lacuna right now. So I think this training has to be inculcated from right from day one of the training of BAMS practitioners.
I agree.
Yeah.
I think that, some of us have been fortunate to find mentors, and be with those mentors who are living models of Ayurveda, right, outside. And they've had the time and, ways to love and be there for us. And so those mentorship models are, those mentors are, we're very fortunate to have that. How do we, um, so with that, what I'm hearing is that this is outside of an accredited curriculum, that the mentorship needs to be outside of a university ecosystem, right? So it has to be like a gurukul.
So the what we can do is probably the senior Vaidyas can train the younger Vaidyas who are coming out from from the learning institutes, and we can do this and not making it as, like everybody nowadays has started making money out of whatever they teach. But
Right,
learning these things, I think this has to come out of compassion, that this is what, as a senior Vaidya, you can pass it on to the younger generation, and out of compassion and not out of the greed to earn money to teach all of these qualities.
right. It can't be transactional, right? And I
Yes,
think we've all been fortunate to have, like, you go to the mentors, they'll feed your mind, they'll feed your body, they'll feed your soul, and expect nothing in return. Right?
correct.
Like, we have those models in front of us, and it is so hard because so hard to recreate that in the world that we live in. But we can, as we as a collective support each other to do. And it is really the need of the hour, because people who come to learn the theory, they are all looking for mentorship. And in the last 4 5 years, I've had so many requests for this, and I just feel like, how do I do it? Because it is such a linear world that we are trained to live in. And the other part is when uh, uh, is that, um, well, the structures of it have to be outside. It has to be unstructured, compassion based, just a free flowing ecosystem. So I think that with the Ayurveda team and others like us who have done it, it would be good to create that framework if it's possible. A lot of people are looking for it.
Yeah.
Yeah, so what we can do is we can have a repertoire of Vaidyas who are ready to teach in this manner, like a mentorship, you know.
Right,
Then the new Vaidyas coming out from the colleges, they can be given in this area. If you are you want to practice in this area, first you can, like, you can go and, get mentored by these mentors in your area. Something
right.
like, you have some directory kind of a thing, then that would be helpful.
That would be very nice to do. I think much needed.
Yeah. Dr. Nami, I'm able to speak now.
Lovely,
Uh,
Aparna ji, tell me.
you don't want to see me on video today. Anyway.
No, I do.
I moved to the US about 35 years ago. So I was telling, not to uh, beg for your compassion, but I did not have a work visa. I did not have a master's in Ayurveda. I did not know what to do.
Right,
I was lost. There were no work opportunities. Nobody was hiring people with my background. I did not have a work visa. I was on a dependent visa. I did not have a master's that I could study. So you had to pivot to something that, you either learn or, you when I got my visa, I had to find something, to do. So this was
Right.
a practical issue. And coming back to your discussion about the guru and mentorship and all that, I think it does not have to be a 0 or 100, something in between where you do pay a guru dakshina, because I think, at least for people like me, that is only then do I become serious, become a serious learner. And the guru also must sustain the current day, expenses and stuff. Previously, probably one student would bring mangoes, the other one would bring rice and things like that. So we have to be practical. So I think it does not have to be a 0 or 100 decision. And
Right.
uh, yeah, so I'm very happy to see this change in the arena and Ayurveda being respected. And um, even when I would, even people highly educated in India who were here, when I say I have a BAMS, nobody knew what a BAMS was. And many people, when I said Ayurveda, they said, "Oh, Jadi Booty." They don't know, and or some mumbo jumbo, something you have learned. So it was not a very encouraging scene then, and
Right.
I'm happy to see this transition. Yeah.
Right. No, Aparnaji, thank you for sharing that. It is hard. It is not easy to come to the United States and try and find your bearing and try and start, you know, uh, promoting yourself as an Ayurveda. It requires a lot of commitment, requires a lot of support from family, because Vaidyas in India, they're at least officially recognized. Over here, you can be thrown into jail for uh, you know, saying that, not thrown into jail, but there'll be legal action against you if you claim to practice medicine. And that really brings us to the important point, Himu, that you said about becoming transactional. So that I've realized that there is a practice of medicine, there is a business of medicine, there is a there is education, and there is a business of education, right? And all of these four components are distinct, but still we want to be able to use every ecosystem to our advantage of compassion, of furthering the cause of compassion. So uh, those shifts are needed, Apanaji, and they will happen with our thought and through discussions like these. Uh, where do we want to go? How do we want to go? Where how do we go there? And how do we recruit support? How do we in the United States support the Vaidyas in India? And how do the Vaidyas in India support uh, the percolation of Ayurveda over here? So these bridge making, the time for this bridge making has also arrived. And you've not lost anything those 35 years. You've done a beautiful job, you've raised wonderful children, and it's so nice that you're drawn back to Ayurveda with such intensity. There definitely must be some calling. And the next 30
Yeah.
years, you have the next 30 years to contribute still, 30,
I'm
40 years to
yeah.
to contribute. So, think about it that way and take your baby steps, but taking them with compassion for yourself is very important.
Yeah. Yeah. Thank you.
Yeah. Okay. Thank you so
Yeah.
much, Anand, for
Thank you,
for
Dr.
for
Namyata.
this time.
Thank you, Dr. Aparna. And okay, so
Thank
we'll be closing the Q&A now, as I do not see many questions anymore in chat. Okay. So thank you everyone and for your active participation and questions. We hope you found this session very helpful. And once again, a big thanks to Dr. Namyata Pathak for sharing her expertise with us today, and thanks to all the participants for joining us. We look forward to seeing you all in our next Gyaan Vardhini webinar.
Anand, there's some
Yes, sir.
there's a request, Dr. Rajiv Vasudevan. Just a minute,
Yeah.
Doc. Can you just accept the request? 1 minute. Yeah.
Yes, Dr.
You
Rajiv.
need to unmute yourself, Dr. Rajiv.
Thank you very much, Dr. Nami, for a very different presentation. That's what I would say, because I didn't quite know what to expect from the talk. Uh, I just feel that some of the points as we speak. I mean, when I heard this point of from doctor to Vaidya, it implies that there is a distinction between the two. And maybe this arises from the US context, and maybe that is why you are speaking. Because fundamentally, I mean, if you look at some of the points, I have a slightly uh, contrasting set of views I would like to state, because there is a fair bit that was spoken. So if I have a minute, I will just share some of those thoughts. Yeah.
Absolutely.
So, yeah.
Lovely. Thank you. Thank you for that.
Yeah. So if you take, see, the qualities of a good Vaidya, as you had enumerated, right, from Charaka, the compassion, the karuna, all the qualities that you mentioned, I feel some of it, and you also linked it to the behavioral characteristics of the doctor. Although you also did talk about Ayurveda being a behavioral system of health where you will bring those changes. But see, the inherent nature of a Vaidya is set, is
Yeah.
fundamentally set. You not, it is not that, I mean, it looks like you fake it till you make it. That's not the way it can make it, right? I just want to clarify. Inherently, people are of different, uh, if you want to put it simply,
Being.
the trigunas are different in different people, the sattva, raja, tamas. So
Right.
to say that one would be this way or that way would be putting actually the cart before the house, the before the horse. Because how do you see, you a guru can bring out some aspects, but to tell that somebody coming out from a college should behave in a particular way, they can fake it up to a point, but ultimately their inherent tendencies will win. So all that can be done is to just say the attributes of a doctor or of a vaidya who is truly, in fact, the most powerful thing, if I want to say, you talked about the word yoga, and I feel it may be misinterpreted that yoga and Ayurveda, the way that shloka is being is being interpreted, maybe being misinterpreted, Dr. Nami, because see, when the highest quality of a good Vaidya is one who places himself in the hridaya of the patient. That is the way
Yeah.
it's told. What does that
Right.
mean? There is no patient, there is no doctor. It's one with the patient,
Right.
right? His self identity has disappeared, so he's one with the patient. He's completely in body and mind with the patient. Now when you take something like this, the yoga that is coming there is the vaidya who is one with his, who's selfless in the sense that who's risen beyond his limited ego and those things. He is in a position to heal. That is why we say the vaidya, the the
Yes.
the Uttama Vaidya is one who is able to treat the Ragadi Rogas. Why? Because for him to be, and that is a core point, because it's not just treating the body,
Right.
is going beyond the body and the mind into,
Right.
let's say, even the Karana Sharira. So, what I'm trying to
Right.
say, are we being too simplistic in trying to imbue certain characteristics? And then to say, because when you look at colleges that the students are coming out, you have a wide variety of students coming out today. There are
Of
25,
course.
30,000 Ayurveda graduates. Many of them are highly motivated, right?
Yes.
May not be and out of 25,000, 2,000, highly motivated, disciplined, with the right attitudinal attributes,
Right.
right? So it's very impressive. You'll be quite amazed to see the new crop of people who are coming out, right?
Right.
So I just wanted to say, are we aspiring to give others something which is not required? Now, the problems that we might be, when I say not required in the sense, who am I to give certain qualities to somebody else? I just want to clarify, because in the sense, I feel that there is a very good ecosystem. People are learning from good. I know I'm being contrarian to the whole discussion happening here. Maybe you're speaking from a US centric standpoint, but I feel more and more there are learning opportunities, and very bright doctors are coming out who have the right values. Dr. Nami.
Right, right. No, I think that uh, I totally I understand and hear your point. My point is not, for the distinction. It does not mean that the crop until now was not good and now the crop is good. I think the crop is excellent. And I think the potential is excellent. There are some amazing Vaidyas who exist, and so many BMS doctors, the fervor and the enthusiasm with which they're bringing forth Ayurveda, it's at the next level. So there is no, uh, I I don't mean to belittle. There is no such thought at all. It's more about how do we enhance and expand into some of these, the emotional, the karma sharir aspects, and how do we bring forth those
Unless
pathways
the
of the
gurus
inner
themselves,
sanskara
unless the gurus
into
themselves,
the
yeah.
into the into the you know there's a sanskara that happens, Rajiv ji, when at age 18, when an individual goes to join an Ayurvedic college to become a doctor. And when they come out at 20, 22, 23, the the attitude with which they come, they transform, they train, they become they become doctors. And the systems do that. But to become healers, what is the inner journey that they take? It's not to really have the same expectation of a certain behavior. No, that's not my point. My point is, how do you how do you express compassion the way in which, for example, I express compassion and you express compassion, Anand express it's all going to be different because it has our flavor in it. But it is our words, thoughts, behaviors which become conduits of a guna. And what are those gunas that exist in of the gunas of Atma? The gunas, when we are able to understand the distinction of the gunas,
See,
and
if I
through
may,
awareness
yeah.
become the facilitators. That is the critical uh, point that I uh, wanted
If
to share.
Mhm. If I may just say here, I've spoke, when you look at people who have spent maybe 40 years as Vaidyas, right? One thing
Right.
they say, every single day they read the Ashtanga Hridaya or Charaka Samhita, and every time they read it, the meaning of a given sloka further evolves. So,
Absolutely.
if at all anything is to be done to move from a doctor to a Vaidya, is the
Yeah.
practice of is abhyasa, is sheer hard work, reading, reading, reading. Everything else is superimposition. See, what evolves from within is natural, right? I have a
Right.
certain natural thing I have to be practicing. The role of the mentor is there, the presence is there, role of the guru, the
Right.
mentor is there.
Right.
But unless there is a clinical practice, so I just want to, otherwise my participation in this interaction would be a waste. So I just thought I would share my views frankly. I don't want to impose myself on the discussion. So let me
Not
leave
at
the
all. Not
stage.
at all. This is very good. You know me, Rajiv ji. This is very important and it's very crucial because these are the thoughts that we have exchanged for that we have lived in and we've been immersed in. And the environment especially that you have created and built for yourself. You're surrounded by Vaidyas, you're surrounded by these conversations, you're surrounded by the futuristic discussions, right? So your worldview from there and your strength that comes from there matters, and I'm so happy that you're sharing that, you see.
Sure. Thank you very much. But I would like to say that I think the future is, the present is evolving and there is tremendous positivity. And the way it has to be rooted in is on the core science. So, if as long as we are stuck in the core science, right, without that, all
Nothing.
the running around is not going to make any difference.
Make it.
All that comes
Absolutely.
later. Yeah. Thank you.
Absolutely. My next piece I've just written just yesterday on my Substack is on Ayurvedya and how Ayurveda is the home of the Vidya and how do we keep accessing the Vidya. And, because there's a sublime quality to it. There's a nurturing quality to it. There's one way that you say a Vaidya has to, he should do this, he should practice, but it is hard. You see, the life of a Vaidya, it's difficult. And how do we create those structures that are nourishing for Vaidyas? And these are conversations that we have amongst as clinicians, you know uh, putting pieces together, learning, going against these,
Sure.
like there are forces. So we need to create nurturing environments for ourselves, and we need to seek them. And this is the my key message was for that we need you, the world needs you. So nurturing yourself, and
Sure.
creating the space for those conversations, and that language, because that language in our mind cannot be influenced by the external world, which is so noisy.
Okay.
So that's where it is. Thank
Thank
you for
you.
the Vaidya Samoos also that you are creating. You want to share a little about the Vaidya Samoo that you have at Ayurved?
Yeah, I think the whole idea is that the doctors exchange their perspectives, and there is a lot of knowledge sharing. Uh, there are so many schools, and one thing I would say that people who are trained in the western part of India, even within western part, there are multiple traditions. If you go to south, multiple traditions. So it's very important to exchange ideas. For example, recently, uh, we had a case of very very advanced bed sores. Three months, patient was in extremely bad pain, and then a particular Vaidya who was trained in a particular school saw that and quickly suggested a very simple salve. It was made of a aushadhi, ras aushadhi with honey. It was applied within 5 days. That 3-month-old severe bed sores totally disappeared in advanced neuro rehab place. So where I'm going in is that there are, and this is not just some, uh, a particular folk medicine or something. It is from the Shastras. So the fact that a doctor trained in another school in another part of India does not know should not deny a patient the advantage of that practice. Similarly, somebody in Delhi, somebody in Kerala, somebody in Gujarat is bringing very different perspectives. So I think through these interactions, one key point I would say, one of the challenges that Ayurveda faces today is that you have a South Indian version, you have a North Indian version. But people have to go beyond the way I apply the to the chikitsa siddhanta before I go to the chikitsa paddhati. The paddhati can vary, or the choice
Absolutely.
of aushadha can change, but fundamentally the principles is what everybody needs to focus. And if you get back, unfortunately today there's an allopathy style Ayurveda which is prevalent in many parts of the world. So, and therefore,
That's what I was alluding to.
no, but it is not easy, because even those who are fighting against it are not clear what is that it is not. So unless one is absolutely clear, and today, unfortunately, again, there is no, forget about an authority. There is no conscience keeper for Ayurveda. So anything goes. So in the process, to restore sanctity, restore quality, the basic the rigor of the science, there is no
Keeper.
keeper. So
Keeper.
in the process, everything goes, anything goes, and that is something which is very dangerous. Somebody in 6 months calls himself a doctor in Ayurveda. After 8.5 years, people still are struggling to practice it properly. How do we encourage a situation where in 6 months somebody calls himself? Even after 4 years, you should not.
No, not just that, they are validated by big organizations in the United States,
Yeah.
and
So
it's a problem.
it's a
So
complex issue, but my
Yeah.
larger point, Anand, Nanavati, Dr. Anand, yeah,
No,
please.
sir, I'm not a doctor actually.
he
My my wife, Dr. Hema Nanavati, she's
That's
Ayurvedic doctor. I'm just a facilitator here.
sure.
So I truly appreciate all the conversation. I'm really sorry. In the interest of time, we'll have to cut
and
short the conversation and do a closure. But
sounds
maybe you can just put your final words, and then we can do this closure.
Yeah, I have
Yes,
nothing more.
sir.
I think I just wanted to say that uh, there is a need for greater
rigor.
eager to come back into
Rigor.
everything that is spoken. Yeah.
It's
Thank you
time.
very much for your patience.
Thank you so
Sure,
much,
sir.
Thank you.
Rajiv.
Thank you so much, sir, for your inputs there. And again, thanks a lot, Dr. Namyata Pathak,
Thank
for
you.
sharing your expertise with us today. So we are looking forward to seeing all in our next Gyaan Vardhini session, which is scheduled on 26th of November, which will be conducted by Vaidya Hima Nanavati. And we'll be soon be sharing the details of this in our WhatsApp community group and elsewhere as well in our CleanSAP groups as well. So
Right.
closing the session here
Thank
now.
you.
Thank you
Thank
so
you
much.
again, Dr. Namyata Pathak, and
Thank you.
everybody who has attended this session. Wish you all have a great day ahead and a great evening ahead.
Thank you.
Thank you, Anand. Thank you,
And
everyone. Thanks
thank
for
you.
inviting.
Yeah, thank you.